So if you're coming to us now and you have problems with inflammation, I want to go through some really important tips to help you to reduce that inflammation so that your body can get into a healing phase quicker. Now, when I talk about inflammation, I'm not talking about just like having a swollen ankle or a swollen shoulder or something like that. Inflammation is really about systemic inflammation, which is where your body's inflammatory response is overactive. And so, whatever is happening for you, whether you have a sore neck or whether you have digestive upsets, that increased inflammatory response is going to make things worse. It's going to mean that your body is more reactive and more dialed in to have it giving you pain and stiffness and a loss of movement. So there are a couple of things that we need to do that we know make a difference to inflammation. So the first one is omega-3 fatty acids. So omega-3 fatty acids are primarily from fish, nuts and seeds, and it's well established that they reduce inflammation. Now you need 2 milligrams of omega-3 fatty acids for it to make any difference at all. Now that's quite a lot, but in a lot of ways, if you can get that in a number of different ways. So for example, 30 grams of peanuts or almonds or walnuts, cashews, that type of thing, 5 times a week can be enough to give you that 2 milligrams. There's obviously fish as well, but the concern with fish is that to get those amounts, you may be exposing yourself to some heavy metals and that type of thing, which is why a supplement is often a good option. So for the supplements, you need to make sure that the 2 milligrams, which is 2,000 milligrams, is how much EPA and DHA you're getting from the fish oil. So if it says 1,000 milligrams on the front, have a look on the back of the bottle and see how much EPA and DHA is in that. Because you may find if it's a lower quality source, it might be 100 EPA and 80 DHA, which means to get 2,000, you need 10 of them. So as I said, that 30 grams of peanuts, almonds or walnuts, that lowers your inflammatory biomarkers. The other thing is to get 40 milligrams of anthocyanins. And anthocyanins, that's a compound that's found in deep red, purple fruits and vegetables. And it lowers your C-reactive proteins. So the C-reactive proteins is something again in that inflammatory chain that increases our body's inflammation. So that could be 20 red grapes, half a cup of blueberries, that type of thing. Now the other thing is a lot of people, so we need to look at decreasing our red meat intake. We know that people that have a lower red meat intake have less inflammation, but also ensuring that you have enough magnesium. 50% of people don't get enough magnesium, and if you're low in magnesium, that is not only going to increase your inflammation, but it's going to slow your metabolism as well. The last thing to look at is turmeric, and you can get turmeric in like a turmeric tea, or you can add turmeric to your food. And turmeric again decreases the production of a protein that makes your immune system work harder. So essentially it's allowing your immune system to work more efficiently. So if you're in an inflammatory state and you're focusing on these in your foods, then that's going to make a difference.